Western Reserve Hospital, 100% patient-centered service.
Hello, I'm Dr. Robert Kent, President and CEO of Summa Western Reserve Hospital. Welcome. Our goal is to provide the highest quality of healthcare in the most convenient manner as possible. The following presentation contains important information for you, your family, and friends to have the very best experience while staying at our hospital. So please watch carefully. And again, welcome, and thank you for choosing Summa Western Reserve.
Our commitment to total patient satisfaction begins before you even enter the building. Our free valet service for all guests and patients means you can simply drive right up to one of our 3 entrances and leave your vehicle safely and easily with our team of valets. No long walks through parking decks or in the rain or snow, and once inside, you'll be cheerfully greeted and escorted to your destination.
Patient rooms at Summa Western Reserve Hospital are clean, quiet, and comfortable, offering you an environment of health and healing. If upon entering your room or during your stay, you have a concern or question about your accommodations, simply use your call light to alert the nursing staff, or dial 0 and you'll be assisted immediately.
Our Help in Hospitality program is another way patients and guests can get immediate assistance. If you feel you need more information about a medical concern or feel you are not communicating properly with a physician or nurse, simply dial 88. You will be helped immediately.
Getting good food when you want it is part of the Summa Western Reserve Hospital commitment to satisfaction. Our room service program provides patients and guests the ability to select and order from a full menu of delicious and healthy foods and beverages. Room service is available 7:30 a.m. to 6:30 p.m. Look inside the guide to patient services for the full menu of choices.
Our non-restrictive visiting hours mean family members and friends can visit with loved ones during the times that best meet their schedules. Early morning, middle of the day, or evening visitation is not a problem. Being comforted with friends and family allows for better healing and recovery during your stay.
Many patients receive prescriptions upon discharge, and to make this process simple and easy, our concierge prescription service will fill and deliver your home-going prescriptions right to your bedside. One of our friendly pharmacists will also visit to discuss the medication and answer any questions you might have. To take advantage of this convenient program, simply tell your nurse or physician at any time.
Patient safety is a priority for Summa Western Reserve Hospital, and to ensure you have a safe and healthy visit, it's important for all patients and guests to follow these guidelines. We wash our hands a lot, and we want our patients and visitors to do the same. Studies have shown that hand washing and personal hygiene are the most important measures a person can use to prevent illness and communicable disease. The proper use of hand sanitizers is also useful in controlling the spread of germs. And never be afraid to ask your caregiver if you're unsure if they have washed their hands.
Patient safety is part instruction and part communication, and one of the best ways to ensure your care is progressing and on track is by having honest and open communication with your physician. Use the notepads provided to write down questions so you won't forget when your doctor visits. Don't be afraid to ask your doctor questions. We want to be sure you are comfortable and understand your program of care. Ask for explanations of any procedures you may be having, the treatment goals, and any side effects. Ask if there is anyone else you should meet on the healthcare team that may be involved in your treatment. Let your doctor know if you are seeing other doctors or healthcare providers. Share information about any recent medical tests, and be sure to provide information about any prescriptions you are taking and dosages. Ask for clarification if you don't understand what you have been told or if you still have questions, and take notes on what your doctor says and any follow-up questions or thoughts you might have. And if your concerns are still not addressed, please ask us again. We really don't mind. We want to help.
Complete patient safety information can be found in your guidebook. Please ask your nurse or physician about any items that you might have questions about. Your presence and support is an important part of your loved one's comfort. To make your visit here as pleasant as possible, Summa Western Reserve Hospital has a variety of services designed for hospital visitors.
Surf the net, catch up on work, or communicate with faraway friends and family members via Summa Western Reserve Hospital's free Wi-Fi service. Convenient hotspots are located in the Wi-Fi cafe near the main entrance, in comfortable family waiting suites on floors 2 and 3, and in the intensive care unit and intensive care unit family waiting suite.
For a hot coffee, soothing tea, or delicious latte drink, visit our Arabica coffee shop, conveniently located inside the main lobby. In addition to a wide range of beverages, you can grab a toasted bagel, chips, or granola bars, sandwiches, and tasty cookies. Arabica is open Monday through Saturday, 7 a.m. to 5 p.m. Beautiful floral gifts are also available for purchase at Arabica, and a self-service assortment of designs are on display inside the Wi-Fi cafe.
For a more diverse offering of hot and cold foods, Summa Western Reserve Hospital's full-service cafeteria has something to please every appetite. Select from daily choices of hot soups, sandwiches, and salad bar, to the hot breakfast, lunch, and dinner offerings. And don't forget to try a slice of one of our famous pies for dessert. The cafeteria is open Monday through Friday. On weekends, guests can order patient trays.
If you're in need of any medicines while visiting our hospital, stop in New Choice Pharmacy, located on the main floor. In addition to filling prescriptions, New Choice offers a wide selection of over-the-counter medications, candies and snacks, cold drinks, and the area's friendliest service. Feel free to speak with one of the pharmacists about your or your loved one's medications. They'll be glad to help you.
Summa Western Reserve Hospital is located in the heart of Cuyahoga Falls, an area rich with local eateries and national chains. There are several restaurants located very close to the hospital. A quick drive north or south on State Road will get you to dozens of eating options.
If you or other family members or friends need overnight accommodations, there are 5 major hotels very close, including Sheraton Suites, Hampton Inn, Courtyard by Marriott, Staybridge Suites, and Country Inn & Suites. Brochures for each of these are available. Please ask your nurse if you'd like more information.
In addition to food and accommodations, there are numerous service and other convenience businesses near the hospital too. Dry cleaning, drugstores, discount shops, groceries, shoe and apparel, sporting goods, auto supply, gas station, and oil change facilities are all convenient for visitors to use. Again, if you'd like more details on local businesses and service offerings, just ask your nurse for a full list of options and contact information.
Because we're committed to improved health, please remember that the entire Summa Western Reserve Hospital campus, including all buildings and parking areas, is smoke-free. We ask that you please do not smoke while in any of our buildings or outside in the parking and entry areas.
At Summa Western Reserve Hospital, we understand the importance of developing a careful and appropriate plan to address your discharge from our care. Whether you are heading to your own home, the home of a friend or loved one, or to a rehabilitation center or nursing home, knowing what to expect both before you leave our facility and in the days ahead goes a long way towards reducing stress and ensuring the best outcome for your continued health. Generally, discharge is a 4-step process.
Step 1. The patient's mental and physical conditions are evaluated by the attending physician and nursing staff, with particular focus on whether or not the patient can safely return to their original living situation.
Step 2. The doctor's evaluation is explained to the patient and any available caregivers, along with the expectations of a discharge day and time if appropriate. At this stage, the patient may learn of further tests and other possible delays that could affect the planned discharge time. Please understand that the planned discharge time is an estimate and can change depending on a number of factors. Nurses will continue to keep the patient and family appraised of the discharge schedule. Future care, including whether to transfer the patient to his or her own home, that of a family member, a nursing home, or rehabilitation facility, will also be discussed.
Step 3. The patient's plan is personalized, including discussing any necessary caregiver training, possible third-party care, and whether any extra equipment, such as wheelchairs or breathing assistance devices, will be necessary. Third-party facilities or home care services that are available to suit the patient's needs, taking into consideration geographic, religious, language, and/or cultural issues, may be recommended at this time.
Step 4. This final phase is designed to ensure that the patient and/or the appointed caregiver has all the information necessary to carry out the task at hand, including a summary of the hospital stay, a list of medications, and important contact information in case of questions or concerns. There may also be a discussion about potential warning signs in the event that a patient's condition should worsen.
While the discharge process marks the end of you or your loved one's hospital stay, it is often just the first step on your road to wellness. By providing you with as much information about this process beforehand, we hope to minimize your stress and confusion, allowing you to focus your time and energy on the task of getting healthy. Again, when speaking to your physician and other healthcare providers, please take notes and ask questions to be sure you feel comfortable and understand the process.
Summa Western Reserve Hospital is growing to fulfill the healthcare needs of our neighboring communities, increasing access and convenience to the highest quality healthcare in the region. In addition to our main full-service hospital, Summa Western Reserve Hospital offers a number of satellite locations with a variety of healthcare offerings.
In Hudson, Summa Western Reserve offers MRI, CT, ultrasound, and vascular testing. There's also a specialty center in that facility with orthopedics, sleep medicine, endocrinology, cardiology, and psychiatric care providers.
Summa Western Reserve Hospital's primary and urgent care facility in Stow is specially designed to offer medical treatment when you need it most. Urgent care patients can be seen with no appointment 7 days a week. Most insurances are accepted.
Occupational medicine services are also available at our Stow site and include alcohol and other drug testing, injury care, physicals, and more. If you'd like more details on Summa Western Reserve Hospital's urgent care or occupational medicine, please ask your nurse for a pamphlet.
I hope the preceding information was helpful and you have the best possible experience while at our hospital. Please let us know if you have any questions or concerns that you may have at any time during your hospital stay. Your satisfaction is our priority. I, along with 200 physician partners, created this hospital with a simple goal:
Improve delivery of a full scope of the highest quality healthcare services, while serving patients in an environment managed by physicians.
That goal is being achieved every day at Summa Western Reserve Hospital, the Northeast Ohio region's first physician-owned, for-profit, full-service hospital.
That is why we came together, to change healthcare by putting patients' needs at the forefront of medicine,
in a way that provides quality, convenient, and affordable healthcare.
Our vision and driving force is to dramatically improve patient satisfaction, and our effort toward being all about the patient really tells a story of where the organization is heading.
We are patient first, and every one of the physicians, nurses, and staff members of Summa Western Reserve Hospital
are working hard to ensure that we are fulfilling that goal every day in everything we do.
Leading the region's first physician-owned, full-service hospital, we understood that we had to commit ourselves to doing the work necessary to excel at satisfying you, our patient.
And we know that work is never finished.
Leading the region's first physician-owned, full-service hospital, we understand healthcare, and most importantly, we understand you, the patient. We know you have a choice in your healthcare, and we thank you for choosing Summa Western Reserve.